Hello, welcome. Hopefully you saw my previous video which talked about testing, number of cases in the UK, how you can interpret the data, challenges, what you can and can't conclude from the data. I'm going to look into the hospital admissions data and see if there's any observable trends over the last couple of weeks. This may be off the back of any increased positive test results that we've seen. So the government website, we can get the number of patients admitted daily. We can see the number of patients already in hospital. We can see the number of patients in the intensive care. We're going to work with the daily admissions, download it as a CSV and open it in Excel. So there's relatively little data in here. What we're going to do initially is just have a look at it visually. The easiest way to do that is add a little graph. So simple line chart showing the number of daily admissions. Clearly it's been dropping off and it seems to be in an upward slope now. And the best thing to do with any of this kind of data, clearly it's a little bit noisy, it's a little bit jagged. So just put a 7-day average over the top of it. The actual term is 7-day moving average. And the way I do it is 3 days of data prior to the data point, 3 days afterwards, the data point itself. And I'll just apply that to all the historical data here. So now when we have a look at this, we got 7-day moving average. It's going to be simpler if I take the graph, put it at the top like so. And we're going to add another data series to this. Possibly the easiest thing to do is copy the existing one, add a new one. Series name is the header line, and then we're going to have this. Oops, I would have messed it up, sorry, apologies. I will do that once more. Now we're using column H. So we have the actual number of daily admissions. We've got a 7-day moving average over the top, which is a somewhat clearer trend to be looking at. Anecdotally, it would seem that we went from a decline to an increase around about the 20th of August. And the question is, how is this increasing? What's the growth rate? So just going to move that out the way slightly so that I've got some space to work. So if we look at the growth factor to begin with, which is simply the number of daily admissions as a percentage of the previous day. Might as well format those as a percentage. So percentage, 1 decimal place should be fine for our purposes. And then the growth rate, whether it's increasing or decreasing, is simply that minus 100% basically. Yeah, missed that one. So we now have a growth rate as well. So let's have a look at, for the same date range, that's from July the 1st onwards, and what is that growth rate? So we're going to insert a chart like so. I'll need a little bit of a tidy up in a moment. So first things first, we're going to move the axis down to the bottom because it's obscuring the data. So that's a bit clearer now. And again, it's jagged data. The easiest way to see what that's really doing is to put a 7-day moving average over the top. So 3 days prior, the day itself, 3 days afterwards. So now let's put that data on top. So again, I'm just going to copy and paste for simplicity from the other line, add a new one, series name, data itself. This time it's going to be column L. Okay, so that's improved matters a little bit. So the key thing here is when the trend is below zero, we're seeing a decrease in the number of daily cases. When the trend is above zero, that means we're increasing. That happened on the 21st of August, which was a couple of weeks ago now, which is around about the time that I thought it was starting to increase. I saw the turn from downward trend to upward, and it's been increasing ever since. Anecdotally, also, the growth rate is increasing. So if we look at the inflection point, so I said it was the 21st of August where we saw it go from a decrease to an increase. This is where things started happening. So we were seeing a growth rate which was pretty low. Sorry, moving average. So this is clearly where it increased. So this is where it was clearly decreasing. It was all negative numbers, and then from this point onwards we went above zero. It's increasing. Now what's possibly cause for concern here is that the growth rate is increasing with each day. The current 7-day moving average is 7%, but yet when we look at the last day it was 9.9%. Now the implications of that and what the numbers could be in a couple of weeks are quite significant. So one thing you can do is if I was going to use a calculator, but now I'll just do this in Excel. So let's start with one person. And then we're going to say on day 2, we've got that number of people times by 1 plus. So that's 100% plus that as a constant. So this syntax here that I'm using with the $ means it's always going to use row 8 in this calculation. So I'm always going to be applying a 7.2% increase on what we had the prior day. So I'm also going to format that whole column like this. So on a given day, we've got a number of patients. The next day we have 7% more. The next day we have 14, 23, 31. So what you're noticing now is it's growing at 10% a day. So how many days did that take? That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's 10 days. So that would imply that the doubling time at a growth rate of 7.2% would be 10 days. So I'd mentioned in a previous video that the growth rate is 7 or 8 days in daily cases. Hospital admissions are lagging behind, and it would seem to be following the same trend. Implications of it being something like that, assuming somehow it can't be turned around, are that it's going to keep increasing for another 2 or 3 weeks. So we've got 1, 2, 3, 4, 5, 6, 7. So that's 1 week's growth. That's 3 days worth. So that's 2 weeks of growth. So that's 3 weeks growth. So potentially in 3 weeks' time, we'll be seeing 4 times the number of hospital admissions we are seeing at this point in time. It was 45 people per day on the 21st of August. It's gone up to 91. It could be 360 or so in 3 weeks' time if you were to multiply 90 by 4. So we'll have to wait and see what happens. I suspect the next couple of weeks will keep on increasing at least this rate. Beyond that point, it may be a bit different. It may be that some of the changes to rules for socializing, group sizes of 6, for example, might have some kind of impact. And we should certainly hope so, because it's not good to see a growth